right ventricular pressure we can obtain the pulmonary artery pressure, pulmonary capillary wedge pressure, or we can say the PCWP. Then we can also obtain the hemodynamic variables, we can calculate the hemodynamic variables by obtaining these values, like systemic vascular resistance, pulmonary vascular resistance. Then we can have the special catheters that are available, we can obtain the mixed venous saturation, we can obtain the cardiac output, as well as we can do the oxygen dynamics with the pulmonary artery catheter. We can have the data from the pulmonary artery to have the oxygen dynamics. What are the direct measurements? Direct measurement, the central venous pressure, PA pressure, systolic and diastolic, then capillary wedge pressure, mixed venous saturation if it is a compatible catheter. Then we calculate the data. I have told you the stroke volume, the cardiac output, the vascular resistance, and the oxygen delivery. And extended calculations, like by using the continuous cardiac output, we can obtain the stroke work, we can obtain the diastolic volume, we can obtain the right ventricular ejection fraction also with the advanced catheters. So what are the clinical significance of all these? Like stroke volume will tell you about the pump performance, cardiac output will tell you about the blood flow, CVP or RA pressure it will tell you about the right heart filling pressure, and for left heart filling pressure we have the PCWP, and for tissue oxygenation we can have the mixed venous saturation. So these are the main parameters we can obtain. Now what is the relationship between the afterload and the ventricular function? If you see that as the afterload increase, the ventricular function will decrease, and it is cumbersome in patients with LV dysfunction. In patients with LV dysfunction, in normal LV function there will be gradual decrease in the, like afterload increases the stroke volume will decrease, and but in the case of LV dysfunction there is a sudden decrease in the stroke volume, cardiac output will increase, and it will be detrimental for the patient. So we should have the evidence based medicine, we should have the full hemodynamic data in these patients to have the optimal treatment of these patients. Like vascular resistance we can obtain, if we have know the mean arterial pressure, right atrial pressure, it's a variable of 80, we can divide it by cardiac output, we can have the systemic vascular resistance, normal values 800 to 1200 dynes per centimeter centimeter, and then we have the pulmonary vascular resistance we can obtain by mean pulmonary artery minus the pulmonary artery wedge pressure multiplied by 80 in cardiac output, we can have the pulmonary vascular resistance. So we can have the afterload values with pulmonary artery catheter. Then another important parameter is the stroke work, that is we can obtain right ventricular stroke work as well as the left ventricular stroke work. So it measures the external work of the ventricle in one contraction. It can be obtained by averaging, it can be calculated by average pressure generated by ventricle during one heartbeat and multiplied by the amount of blood ejected during that heartbeat. That is we can calculate the stroke work, although we don't have to calculate, the machine will calculate, the software is there in the machine. And 0.0136 is the factor which converts the pressure into the work. So this is the formula for that, like stroke work is mean arterial pressure minus LVDP into stroke volume into 0.036 is a variable to convert the pressure into the work. And this is the left ventricular stroke work, and this is the right ventricular stroke work. If we know the stroke work, mean arterial pressure minus PCWP multiplied by this variable, this is the normal value, and we can also obtain the right ventricular stroke work, that is the mean pulmonary artery pressure minus the right atrial pressure. This is a variable, it is around 1/10 of the 7 to 8 of the left ventricular pressure. So the stroke work we can also obtain from the pulmonary artery catheter. And these are the various normal values you should know. Okay, what is the value, what is the normal value in a particular patient, what is the value of various parameters we obtain, what is the clinical significance, we can have all these parameters, different values are there. Then the data interpretation, how we do the data interpretation in these patients, like on a simple monitor in a